Hi, I'm Russell Bramhall. I'm a plastic surgeon with a particular interest in facial rejuvenation surgery. Upper eyelid surgery is one of the most popular procedures that I do in my facial cosmetic practice. Heavy upper eyelids are one of the most common signs of aging that our patients complain of. Sometimes heavy lids are not even the result of aging. It's simply a natural feature of the face that can make someone look tired even when they feel youthful and anything but tired. The procedure itself is relatively straightforward. In essence, it's a minor operation to remove skin, and sometimes a little muscle and fat too. But it's a superficial procedure, normally done under local anaesthetic as an outpatient. The key to the whole procedure though, and the bit that varies from surgeon to surgeon, is the design of the skin excision. The design on how much skin to remove and how much to leave behind. That's the important bit. If you look at a youthful eyelid and one that's considered attractive, it's not hollow. It's normally full and has a fold of skin present naturally. So what we don't want to do is take away too much skin that makes the eye look hollow. Sure, simply removing skin makes the eyelid less heavy, which might be enough for some people, but most of our patients want to try and achieve an eyelid shape that's youthful and attractive, and that's where the unique skill set of your surgeon becomes pivotal. If you have a look at this before and after, you can see that the eyelid shape afterwards has a youthful softness to it. We could have taken a few more millimeters of skin, sure, but that would have given her a lid that would look more hollow and even less attractive, or we could have taken some more fat or more muscle, but then we would have lost some of the youthful softness that for me is really important in creating an attractive result. If we look at this example on a more mature patient, again, we see that I've not taken away all of the skin that I could have. I've deliberately left behind some of the skin so that the contour of the lid looks soft and more attractive. And another example, this time on a younger patient of mine who was still in her 30s. This is the sort of patient who naturally had a full lid her whole life, so was predisposed to it becoming excessively heavy at an early stage, making her look more tired than she felt. In this sort of patient, it's really important that we conserve the natural fullness of her lid so that we maintain the character of her face. Had we taken too much skin from her, it would have changed the appearance of our eyes, and I don't think she would have been happy with that. I guess eyelid surgery looks pretty straightforward, and from a surgical point of view, it is. But that doesn't mean it's easy. Getting the aesthetic judgment just right is the most challenging part, so we can achieve a result that's both natural and attractive for our patients.